All right. Hi, everybody. Dr. Parmeshwar asked us to introduce ourselves. So I'm Violet Borowicz, for those of you who don't know me. I've been at Carilion for 6 years now. I do PT MOC, Peds Palliative Care, and I am now the Associate Program Director of the Peds Residency.
And I'm Lori Dudley. I'm a psychologist in the Pediatrics department.
All right. So we do want to make this interactive. We were asked by Dr. Parmeshwar to talk about sort of wellness during the pandemic and what we're doing to cope with all the changes. And so that's what our topic is today. We have no financial disclosures. Our objectives are to identify the stressors that are unique to a pandemic, identify the signs and symptoms of significant distress, and then discuss new methods of coping. So
what's on the screen, and for those of you who are calling in, I'm going to read it out. It's checking yourself for burnout. It's kind of a neat little tool that is quick and dirty. You can just kind of check in ever so often, and I recommend checking in ever so often. You can find it on mindtools.com, and I'm just going to take a minute to read each of the questions to you, and I want you to, if you can, to write down your rating. It's a Likert scale 1 to 5. I'm going to read a statement, and then you decide if it's 1, not at all true for you, rarely true for you is a 2, 3 is sometimes, 4 is often, and 5 is very often. And don't worry, I'll repeat that periodically so that you can just calculate in your head or jot a number down. Okay. So the first one is, I feel run down and drained of physical or emotional energy. 1, not at all. 2, rarely. 3, sometimes. 4, often. 5, very often. I have negative thoughts about my job. Not at all is 1, rarely, sometimes, often, and very often is 5. I am harder and less sympathetic with people than perhaps they deserve. I'm easily irritated by small problems or by my coworkers and team. Again, 1 is not at all, 2 rarely, 3 sometimes, 4 often, 5 very often. I feel misunderstood and unappreciated by my coworkers. I feel that I have no one to talk to. 1 not at all, 2 rarely, 3 sometimes, 4 often, 5 very often. I feel that I am achieving less than I should. I feel under an unpleasant level of pressure to succeed. 1 not at all, 2 rarely, 3 sometimes, 4 often, 5 very often. I feel that I'm not getting what I want out of my job. I feel that I'm in the wrong organization or the wrong profession. 1 not at all, 2 rarely, 3 sometimes, 4 often, 5 very often. I am frustrated with parts of my job. I feel that organizational politics or bureaucracy frustrate my ability to do a good job. I feel that there is more work to do than I practically have the ability to do. 1 not at all, 2 rarely, 3 sometimes, 4 often, and 5 very often. I feel that I do not have time to do many of the things that are important to doing a good quality job. And I find that I do not have time to plan as much as I would like to. Not at all is 1, 2 is rarely, 3 is sometimes, 4 is often, 5 is very often. So take a moment to add up your scores. So 15 would be the lowest score you could get because there were 15 questions. And if you rate it all, not at all, please come see me because I want to know what you're doing right, because that would be the lowest score and you would have no sign of burnout. So the score category is also on the screen. 15 to 18 is no sign of burnout. If you scored 19 to 32, little sign of burnout unless some factors are particularly severe. So if you answered some questions as more 5s, let's say you answered 2 or 3, or 4 or 5 questions as 5 and the rest is 1 or 2, you may not be having burnout, but I would encourage you to look at what those questions were so that you could maybe focus some of your coping strategies that we'll talk about more on those areas. 33 to 49 is be careful. You might be at risk for burnout, particularly if several scores are high. 50 to 59, you are at severe risk of burnout. Do something about this urgently. And 60 to 75, you are at very severe risk of burnout. Do something about this urgently. And we'll talk about some things that you can do, but we want to be mindful that it's just not for today. These are things that you're going to need to continue through. And I think it's important to maybe occasionally go back to these questions and maybe take this test again. Again, it can be found at mindtools.com, and periodically check in with yourself and see if you see some areas that have improved. Okay.
This is just another method of checking in where you don't necessarily need to do the score, although the score can be helpful. This was one that I found from the Canadian Medical Association, actually, where you could just look at sort of your baseline and how you're reacting to different things that we're experiencing right now based on your feelings, your thoughts and thinking, physical signs, and then behaviors.
Okay, so now that we've kind of probably increased your awareness of it's possible that you're feeling a bit burned out, you're maybe in the reactive stage if you saw the previous slide, what are some things that we can do just right now to kind of ground ourselves and get on track? And this is something that you can do throughout your day. It's just take a breath. Now, I realize that sometimes when people say that, it almost comes across insulting, like take a breath, slow down. Well, clearly you're breathing, but let's talk about what's the most effective way to breathe. And that's diaphragmatic breathing, or what we might call belly breathing. And for that to be most effective, when I'm teaching the kids in my clinic how to do that, most of them, not all of them, have a pet. And I ask them to visualize their pet in a window with the sun, like a dog laying with the sun coming through the window. And you guys can do this yourself. And you'll see their little bellies expand. And not necessarily their chest as much, but it's their little bellies. And that's sort of the way that we humans need to breathe. But instead, when we say take a deep breath, and I think you guys can kind of see my hand if you're watching, I put my hand on my chest and my hand on my belly. Like if you go to the doctor and the doctor is checking you with a stethoscope and says, take a deep breath, you often find that you kind of go like this. And just the hand on your chest moves. But really, to have really good, effective breathing, you want to breathe down into your stomach, down into your abdominal walls and diaphragm to really help relax. So I have kids practice by putting a hand on their chest, a hand on their stomach, and to breathe into their stomach so that this hand moves out. And of course, I can exaggerate it with them and they laugh because I'll stick my belly out really far. So you would breathe in, and this is the hand that should move, not the one on your chest so much. And that is what we call, like, again, diaphragmatic breathing. Singers often have learned this really well. And it's easy to do when you're just sitting in your office. Sometimes if I'm in a stressful situation, I'll just, put my hand on my stomach and make sure I'm breathing that way. And no one has to really notice that. It just kind of resets your breathing and allows you to be calmer and more focused. And in fact, the Marines or the Navy SEALs use this, and if they can use it, then I think that it's probably a pretty good thing. And another strategy that we're going to do, that I'm going to demonstrate, is what we call box breathing. And that literally is envisioning a box as you're taking in your breath. So you would breathe in like a square, like breathe in and count 2, 3, hold 2, 3, out 2, 3. Hold 2, 3, in 2, 3, or 3 or 4, whatever's comfortable for you. But the important thing about that type of box breathing is it's what I remind the kids that I work with, and what I would remind you guys is it's very difficult to have another anxiety thought or an intrusive thought that might be negative while you're focusing on breathing, counting, and visualizing. So you're using some different senses there, that the more sensory input you can do, the less likely you're going to allow for those intrusive thoughts. So it's hard to think, okay, breathe in. Oh, I'm worried about my test. Oh yeah, count 3. Oh, I'm so nervous about my test. 4, it just gets too confusing. So that's a good way to slow down and kind of ground yourself. And we're going to take a second to maybe do this for a minute and just kind of ground ourselves to continue through for the rest of the presentation. So this is on the screen for those of you who can see it. And I just encourage you to follow through, maybe put a hand on your chest, hand on your stomach, and just make sure you're breathing down into your stomach. So deep inhale in, hold, exhale, 3, 2, 1, hold. Deep inhale in, down to your stomach. Hold in the breath, 3, 2, 1. Exhale out, 1. Hold, 3, 2, 1. Deep inhale in through your stomach again. Hold your breath in. Exhale out. Keep it, hold it out. Let's do one more round. Deep inhale in. Hold it. Exhale out. Hold it. Okay, and then breathe in again. So as you can see that you can kind of do that on your own, visualizing your own box, or you can find one of these on the YouTube. And there's all types of breathing apps out there that kind of teach this, but this is just a quick, easy one that you can watch the square and kind of focus on something. And again, I think it resets us and kind of grounds us. Okay, so I guess I'm supposed to be doing that. So I'm making you do it. So why are we talking about this? Burnout, moral distress, wellness, they've been big topics for many years, and it's only getting bigger now, primarily surrounding the pandemic. I mean, it was going up the hill, so to speak, but it's definitely kind of peaking now. Then these are important topics to talk about. So the World Health Organization has a new definition of burnout. It used to refer to it as a state of exhaustion, but that was a little bit vague. And this new definition is going to give more credence to burnout and help providers in getting help. This definition will go into effect in January of 2022. It's included in the 11th revision of the International Classification of Diseases as an occupational phenomenon. It's not classified as a medical condition. Okay. Burnout is a syndrome conceptualized as resulting from chronic workplace stress. Notice it says syndrome and chronic workplace stress that has not been successfully managed. It's characterized by 3 dimensions: feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. So think about those for a moment, and there's a good chance that you recognize some of those in yourself, possibly. Notice that the definition, it really talks about what's called an occupational phenomenon, and it's characterized by chronic workplace stress. So basically, if you're hearing that, that's basically saying we need to fix the workplace, not necessarily fix the professional. So I think this new definition is going to really help us in being able to get help more effectively and efficiently, and help organizations to make some changes as well. Okay. We also talk about moral distress. I think it's important to define moral distress. It's an emotional state that arises from a situation when one feels that the ethical action to take is different from what they're being tasked to do. This can be because of policies and procedures that may prevent one from doing what they feel is ethical. And the reason it's important in this context is that moral distress can be a contributing factor to burnout. Some have, I think, during this pandemic, many people have probably been confronted with moral distress when dealing with patients who have COVID or who are suspected of having COVID. And I'm sure that we can think of some examples where maybe it's happening to us as providers. So, I know sometimes I feel sort of morally frustrated, if you will, that I can't maybe have some family members come in with my patient, or those who are on the COVID units, really can't have family members, and that's important when someone's having medical care to have their loved ones around. But in these times, it's not necessarily what's best, but it still feels like it's the moral right thing to do, and it's kind of sad. So that can kind of start to, over time, contribute to burnout. Okay. So let's think about, when we talk about distress and burnout, what are some symptoms that you might be experiencing burnout? You might be having feelings of sadness, depression, failure, helplessness, or apathy. You're becoming maybe more easily frustrated with your family, with your peers, with your workmates. I want you to kind of think of these and see if they're applying to you. Blaming others or feeling generally just irritable. Feeling disassociated or indifferent or apathetic. Isolating or disconnecting from others. And of course, I think we're all sort of doing that a little bit just because of the pandemic and the social or physical distancing that we're trying to practice. But I do think that this speaks to a louder or a bigger issue as well, not just from pandemic related. Okay. Practicing poor self-care. Feeling tired or exhausted or overwhelmed. And using negative coping strategies. So we're going to spend a lot of time talking about well-being, but what exactly is well-being? And there are a lot of different definitions out there, and they do vary, but most of them ultimately include positive emotions and moods and just general satisfaction with life. There are many types of well-being, such as emotional, physical, economic, social, occupational well-being. And it's important to realize, like, even as I name those, I think that every one of those types of well-being are probably currently being impacted by this pandemic. So emotionally, it's quite exhausting. We may not have all of our coping strategies in place. Physically, we're tired. We may not be able to practice our exercise, or we're just worn out from our shifts. Economically, many people are taking pay cuts, or some people don't even have jobs. Socially, we're sort of distancing. Occupationally, we're having to change our job, and every day there's a new rule that makes it a bit more frustrating. So it's important to remember that the goal is to have good well-being, but it's also in different areas, and think about, so if you can't impact one area, maybe you can impact another area that might kind of balance it out a bit. Okay.
So, like we've been talking about, the reason that we are talking about this now is that even though this topic has been so big for so long, there has been an increase in stress and burnout for physicians and healthcare providers because of the pandemic. I'm sure many of you have heard and read about the increase in physician suicides, and there's been a lot that's been happening, which is why we wanted to bring this topic up. And so like Lori mentioned, the physical isolation, the surge in care demands, equipment challenges, ongoing risk of infection have been all huge contributors to increased stress and burnout. So we just wanted to talk about some mindset of what you guys may be feeling or experiencing during COVID. And this is where we would like it to be a little interactive. So if you guys could send us sort of your thoughts about how you're feeling, you can send it privately or to everybody. But what is going through your minds, working through this pandemic?
Yeah, I would love to see some chats coming up. Not all at once, everybody.
Okay, I'll start with giving one. Do I even know enough about COVID to treat it? Does anyone? Trying to keep up with the ever-changing science of what we're learning is difficult and frustrating sometimes, because I think there's a lot of fear and of doing the right thing and not doing the right thing.
Some of you are typing in fear, mentally exhausting things work-wise, or feeling like you can't do anything right based on frequent policy and protocol changes, which plays into doing the right thing. That's correct. And we're hearing a lot of that from other providers. Definitely there's some frustration by changing guidelines and everything from PPE to travel. And I don't know about you guys, but I will share that when I first started getting all those emails when COVID came about, it just was so overwhelming for me. I was like, oh, think about travel. Oh, changing PPE. Oh, yeah. Oh, and Violet has the perfect next statement.
Another big issue is being exposed to too much information, the 24-hour news, social media. We've never had this in the history before, and it's overwhelming. Frustration. Less frustration with the disease itself, but more so with the guidelines that seemingly make no sense. Having to change my standards of care to try to take care of patients. What will happen when other seasonal respiratory illnesses add more patients into the admissions mix?
I love the one about not conveying empathy to family with whole face coverings. I mean, that for me as a psychologist is difficult because we're talking about very personal things, and they can't see if I'm smiling because I'm happy for them or if my facial features are more sad. And Violet, I imagine you're really in that boat, giving
between having to tell a family that their child has cancer covered up in all of the garb, or even talking to my palliative patients at the end of life, it's been a huge change and extremely difficult to have these conversations when you can't convey the empathy that we used to.
You can't even really touch them, like give them a squeeze, a hug, or say, I know this is hard, I'm here for you.
No travel, kids homeschooling. Frustration about public health measures like wearing masks getting polarized. Worsening rapport with families who won't follow guidelines. Yep.
Oh, all of these are really good points, and a lot of them we're hearing from lots of people. So you're not alone out there when you're putting these comments in.
How to handle blossoming patient volumes with limited numbers to providers and limited hours in a day. You don't go in patient rooms as much if they're in isolation. Yep. Increase in teenage depression and anxiety treatment.
And I'm seeing a lot of that, actually. I'm not going to say a lot. I'll speak just for myself. Some of the kids I work with, particularly if they're already prone to some anxiety, this is amping it up quite a bit. And now with school starting, our referral resources are coming back in because we're getting a lot of questions about kids being anxious about starting school or catching COVID or social distancing, all kinds of questions.
Feeling impaired with assessment of patients with their mental health problems because I cannot see their affect or face as well. Makes people feel like they're not doing as good a job or the right thing. Worry about bringing COVID home to family members or potential exposures affecting family, which I will say is true. My mom actually asked me if I have taken care of any COVID patients, and I had to tell her that I did have a positive patient. And the look on her face really just hit home, since my parents are not in medicine, and so they are really struggling with me being in this field now. Hard not knowing how long this will last or what changes will be permanent. Definite increase in anxiety, depression, suicidality. So yes, these are all everything that everybody's feeling, and that's a little bit of what we wanted to bring to this talk today, is just to say that we're all feeling similar things.
That's a good point about being an empath and feeling that as an empath, you feel everyone's stress, and then you're wondering what is mine and what is theirs. And I think that is kind of hard to tease out.
Yeah. Some other things that we thought of: do we have enough PPE? What PPE am I supposed to wear today? That constantly changes. I could use a haircut. So could my kids. I haven't had my haircut since before the pandemic started. Telemedicine, virtual care, what and how do we code it?
Constantly changing, by the way.
I am providing care for families, but who is providing care for my family? Should I stop hugging my family? How do I keep my parents and children safe but connected? What if my colleagues find out that my kids just watched 3 hours straight of YouTube? The whole screen time with the AAP has gone out the window.
Yeah.
Especially when you have kindergartners starting school and they are virtual and having to sit in front of a computer. So emotions that we're all experiencing, and I think we touched on a lot of this. I'm nervous. Will we have enough supplies? I'm afraid. What if I get COVID and transmit it to my patients or family? I'm proud my coworkers have come together, or alternatively, I'm disappointed because they haven't. I am worried. How much longer will this go on? Will I still have my job? You think, a lot of people talk about going into medicine and having, word.
I know what you're talking about. So that you have job security.
Job security.
You're in medicine.
Yes, thank you.
You have job security. Yes.
Thank you. Job security.
Yeah.
You go into medicine thinking you have job security, but I know several of my co-residents have been laid off or furloughed from their private practices because of the decrease in revenue.
And that's the irony of this, I think, is, we're in the medical field, and yet the medical people are being furloughed for a medical reason. I mean, a medical pandemic. It's so ironic to me. It's hard to wrap my head around.
For the graduating residents, will I get a job?
Oh, that's a good one. Yeah.
I am sad. I'm hearing so much death and sadness. I am frustrated. There are so many changes that I can't seem to keep up. I'm happy. I still get to be with my family and have a job. Am I crazy? People are posting pictures of gatherings unmasked. People are traveling to various places while I keep my family on lockdown.
And I just want to take a minute before Violet goes to the next slide. I think it is kind of important to identify, reflect, think about, however you want to word it. The difference in your thoughts are one thing that can contribute to your emotions, or it can go vice versa. But I do like teasing out, and I try to work with kids in doing this, teasing out feelings or emotions. So feelings are, I'm afraid, I'm sad, I'm worried. Thoughts are, I might lose my job, I might get sick. It's important to kind of tease the two out. And you as parents and as pediatricians working with kids, I think the earlier we can start talking about feeling words, the better, because when they get to my office sometimes at 10 or 12, you'd be surprised at maybe they just know 3 emotions. I'm mad, I'm happy, I'm sad. And it really is hard for them to talk about emotions. So I think it is important to, if you come home from work, it's okay to say, wow, I was really nervous today. I didn't think that we would have enough supplies, or however you want to start modeling talking about emotions.
um, some other factors that are unique to pediatrics, getting patients in for appointments. You know, I've seen a lot of things in some of the groups I'm in about our diagnosis being missed or delayed due to inability for practices to care for patients with appropriate PPE due to fever. One of my recently newly diagnosed patients actually expressed frustration that she felt like she wasn't being seen or heard by her general pediatrician because of the fever. And she expressed that she felt like there were delays because of that, because of the pandemic, because she couldn't be seen in the office. And I've heard a lot of people in the pediatric oncology world actually expressing concern about delays in diagnosis because of not being able to get patients into practices to get worked up. Similarly, well child check delays were happening for a couple months, which led to a significant decrease in revenue for the outpatient pediatrics. And then even vaccination, there's a lot of talk about how are we going to see emerging diseases in other places now because vaccines have been delayed. Decline in patient visits that have led to the decreased revenue. Like I mentioned, private practice have closed or furloughed physicians because of decreased patient volumes. We know some just newly graduated residents have lost the jobs that they've had. We know people who have been in practice for years have lost their jobs. And then the graduating residents worrying about being able to get a job. And then, as this is also mentioned before, the changes in how we connect with patients and family, not being able to hug them, not being able to show the emotions that we want to show because of all of the PPE we have to wear when we try to connect. I am a hugger. I always hug. And so this has been a huge change for me to not be able to hug my families. And I will say, when I got back from maternity leave right at the start of this pandemic, and one of my sweet little 9-year-olds who hadn't seen me in months was so excited and came running down the hall to give me a hug. And I said, "Oh, we can't do that." And his response was, "Is it because of Corona?" And he just stood there so sad because I wouldn't hug him. And it kind of broke my heart a little bit because I felt so bad in the beginning with this. And then, answering questions from families, even some of you guys who have kids who are older, like daycare, school, when is it? How will it be safe? What is the right answer? How are we going to keep our kids safe, get them the education they need? How are we supposed to balance virtual learning at home and having to work? Mm-hmm. There are a lot of physicians I know that have stopped working because they can't do it. So, personal changes and challenges, as Lori mentioned earlier, our typical outlets for coping have been taken away or they've been modified. The way we socialize has changed, virtual versus in person, waves versus hugs, people who going from handshakes to fist bumps or even elbow bumps now to try to, prevent infection. Our isolation from our family and friends who live out of state. My husband and I don't have any family anywhere near us. My family lives outside of DC in Maryland, and I haven't seen them since my son was born in January.
Wow.
My husband's family lives in Michigan, and we haven't seen them since last fall. The inability to go to the gym or other places that support stress reduction. I know the gym is opening back up now, but for so long, there was times where we couldn't do those things that we used to do.
I don't know if some of you are seeing the funnies on the slides, but they are awesome. So I encourage you to read them. I really like this one. It's the heart saying, "I bought a thing," and the brain is saying, and the heart says, "And now I'm happy." And the brain is saying, "Are you?" And the heart is saying, "Well, maybe not as much as when I first bought it, but see, that kind of happiness is temporary," says the brain. And then he comes back, "I bought a thing." And heart says, "No." I think a lot of us, Amazon is definitely going to lots of houses, I think.
Absolutely. I think online shopping has been good and bad.
Yeah.
Also, the decreased ability to travel. I love to travel. We have not done so in 8, 9, I don't even remember, a long time now. and a lot of that, at the end of my pregnancy, I wasn't going to travel. And I was like, okay, after I give birth, I'll be able to travel again. And then the pandemic hit, and that's completely changed. Some other personal changes and challenges. Your relationship with your partner. How have their means of coping changed? So it's not just our own stress and stress that we're feeling at work, but even the stress in the house. Your partner may not be coping with this as well, or maybe coping with it better than you are because they're not in medicine and they have a different sense, or they are stuck at home and working from home. I know my husband is working from home, and as much of an introvert as he is really struggling with this right now because he misses people. Just because he's an introvert doesn't mean he doesn't like people. Another issue may be, do they view the pandemic differently from me? Are they, not as taking this as seriously? Will they not wear a mask in public? That's really hard.
I imagine that's hard for you as a provider or any of us, because then if your husband comes home and he's not wearing a mask, but you're treating people the next day, it's very frustrating. Mm-hmm. Yeah.
Relationship with children. Dealing with the school changes and making the right versus wrong decisions for your family. Right now, I feel like there is no right or wrong answer because we're all trying to do the best we can. Relationships with your extended family. If they're not in healthcare, do they understand why they're having to be isolated? I will tell you, my grandmother lives with my parents, is close to 80. She is going through chemo for ovarian cancer. And so I refuse to go up there to protect her. And she is extremely mad at me for not being able to meet my son. Mm. And especially since he's named after my grandfather, she's even more mad at me. And so now she won't talk to me.
That's hard.
Again, challenges unique to healthcare providers. How will I protect my family from me? I go home. I shower before I do anything else. I have a separate laundry basket for the scrubs that I wear to work, and I keep it all separate from my son and my husband's clothes. How do I handle the views of others with whom I may not agree? Being a constant role model or ambassador to the hospital is sometimes difficult. So I hear this a lot too, where, we are the face of healthcare in the public. So making sure that we are masking up appropriately when we go out to the grocery store or go out anywhere, it takes a toll because it is a weight that we're bearing. Triaging potentially infected patients. And then again, answering questions about COVID because it keeps changing. I am struggling to keep up. So what can you do? This little cartoon that's up, the brain is looking at the heart is looking at a pile of good things and is saying, brain, look. And the brain is looking at a tiny pile of bad things and says, not now, heart. Can't you see that I'm busy?
So focusing on the bad.
So first and foremost, I want to say it's okay to not be okay. We are trying to do the best we can. And I recently read an article in the Washington Post about toxic positivity and how constantly trying to push the positivity can also become problematic. So just realizing and acknowledging that you are struggling and it's okay that you're struggling. Take a breath. We're all struggling with some aspect of this in one way or another. And it's not a sign of weakness that we are. It's also important to know that some of us are struggling more than others. Some of us have a better handle on this. Reaching out to a trusted friend or colleague for support is okay. And then giving yourself some grace. Know that you're doing the best you can. I wanted to share a little advice from a trusted colleague and friend. Dr. Lisa Urich, who we all know and love, she sends out these wonderful little stories to her ER department once or twice a week, Lisa. So this was a story she had sent out. But this one goes out to all the helpers out there. It started with a quote. Some people aren't good at asking for help because they're so used to being the helper. Throughout their life, they've experienced an unbalanced give and take. So their instinct is usually, I'll figure it out on my own. The self-reliance is all they've ever known, by Tony Tone. So Dr. Yerk wrote, my guess is that many of you, like me, identify as a helper. It is what drew us to a career in healthcare. We have a desire to help people, and we are quite good at it. Helping people brings us joy and makes life richer. What a privilege to have a job where we can get to do this every day. What I would like to do in turn is turn this on you and remind you that other people feel the same happiness and fulfillment from helping you every now and then. It makes them feel closer to you and fosters trust. It doesn't mean that you are weak or failing if you accept help. It means that you are human and that you have people in your life who care about you. Don't deprive the helpers around you from the pleasure of lending you a hand. Everyone deserves a lift from time to time. And Lisa Yerk is wonderful.
That was a comment and from Tanya. But I think that really speaks that we really all should remember we enjoy helping. Let's not deprive someone else from that opportunity when we need help. Okay, so we talk about self-care, and I think that it's important to kind of think about what are some obstacles to self-care. And maybe this could be interactive as too, so we have some time. Like, what are some of your obstacles to self-care? And you can write those in the chat and we'll read them.
And I'll put our first one up.
Yeah, if you're saying this, self-care, what is that? Then you need to come see me for other reasons. We need to talk about that. So hopefully we all have an idea of what self-care is. But what are some obstacles to it? What are you finding as your obstacles right now?
Time.
Oh, time. Yes. Hard to motivate working out at home alone when we used to could do it with gym or at the gym with friends or do something with friends and work out. Yep. Needing extra sleep, wanting it, but it doesn't seem to work out. And not feeling allowed to care for self. These are good. Oh, sorry. Can you do that? I'm too tired. It's selfish of me to take time away when others are working.
Finding it hard to pull myself away from screens to meditate or read when life has become more screen-centric. Absolutely.
Well, that's a good one. Yeah.
Turning off the news and watching a funny movie.
That's good.
Worrying about others and patients' needs. Staying out of the nail salon.
Can you do it?
No,
sorry. I'm not doing enough to take a break. Maybe you're telling yourself that. The only way I can contribute is by working. I think this is a big one too. I don't want others to know how affected I am as they seem to be handling it better than I am. After work time is time for my family and other obligations. It's not me time.
I will say this really resonates with me because I am a new mom. And so I don't take time for myself because as soon as I get home, it's all about the baby. And I am learning to try to take 5 or 10 minutes. One thing that's really helped me is my husband does bath time, and I get that time during bath time to myself. And even if I'm doing something around the house, at least I'm by myself and like just thinking, taking time for me during bath time.
Which I think is important that, I've had people say, well, how do you do self-care? Well, just start small, 10 minutes, or 20-minute bath time. Just carve out the time and agree to stick to it. Okay. It's important, I think, any time, but definitely during this stressful time to kind of do some self-reflection, to ask yourself, what am I doing well? And you're doing something well. We're showing up. At a minimum, that's good. That's fine some days. Just showing up is fine. But I think you need to take time to reflect daily on what you're doing well and what you're grateful for. Because I think that we can all find things that we're doing well and that we're grateful for. Even if you take it a step further and journal it, I think that would be really healthy. But at least taking the time to self-reflect. Also, how can we incorporate some self-care into our lives? And again, we talked about starting small, 5 minutes, but oftentimes I ask people, what is one thing you can commit to for the next week or for the next couple of days that would help you with your self-care? Is there something that you could do to reduce your stress? Could you walk for 10 minutes at lunch? Could you do a 5-minute deep breathing exercise? Am I communicating my needs to others? I think sometimes we all get so caught up in the work that we forget to communicate what we need, and we just say, oh, I'll just do it myself. But it could relieve some stress if you communicate with others what you need. Am I reaching out for my support? Do I need to set more boundaries professionally and personally? Someone in this room does. And it's not me, I don't think. Needs to just sorry to call you out. But just, not accepting too much professional obligations, or alternatively, maybe not too much personal. Just having a nice balance, I think, is what's important. And am I taking time to do any self-care? Violet is going to talk a little bit later in the presentation about peer support. But I want to take a moment to kind of talk about why is peer support so important? And honestly, if I speak for myself, at first I was like, oh, I have plenty of peers. I have a nice social life. But in this context, we're talking about that's important, but we're talking about kind of having a supported, trusted colleague that you consider in your field or somewhat close to your field, that you can share things with, that you can share those feelings of, I was really worried, or I felt embarrassed, or guess what, I messed up, or I was afraid. And this is important because it allows for a culture shift away from being silent to sharing. And then by sharing, we can often show others that, hey, we're all kind of human. And I know we've all experienced this sometime when we've sort of admired someone from afar and thought, wow, they've got it together. And then they come in our office and say, wow, I just blew it. I just did this. And, you're like, oh, well, they are human. And now maybe I could go to them with my problem and feel trusted, that they're not going to go spread this to anyone else. But another reason that it's important is it also allows for even just basic safety. I mean, if I share with a colleague where I might have screwed up, maybe I saved a situation from happening with their patient. But it's also important to keep peer support in mind, because peer support has been shown to be a contributing factor of burnout. So a lack of peer support has been shown to be a contributing factor of burnout. And I think right now during this pandemic, we're all being quite separated, and some of us are working from home, some of us are changing shifts, not working with our normal regular colleagues, and we might have extra demands that don't allow for that check-in that we might normally do in the office. We're kind of discouraged from being too close, so hanging out at the microwave may not be the best idea. So these are also reasons why we have to kind of think more intentionally about, hey, am I able to check in with my colleagues? And I know Violet and I have been on some calls where we've heard that it is a little odd not to be able to check in with them, because of the changes in schedules and whatnot. You feel a little out of sync, I think. Okay.
So I did want to talk a little bit about meditation. I know Dr. Bagtani had done this during her presentation. There are a couple of great apps out there. Calm is one of them, which I do have, and Headspace is actually free for healthcare workers until the end of the year right now. And we are going to actually take 3 minutes to do one of the Headspace, if I can get it to load.
And while Violet's working on getting this loaded, I will give her lots of kudos. She is PowerPoint queen, and I'm just amazed at her quickly working through this PowerPoint. It stresses me out, if I'm being honest. So it's good that she's just on it and comes up with all the funny things.
So no matter what it is, it's left you feeling. So no matter what
Okay,
it is,
we're gonna
it's
try that
left you
again. Here we go.
feeling.
Okay.
It's left you feeling. So no matter what it is, it's left you feeling overwhelmed. Just take a moment. Yourself pause, understand. Just begin by taking a big deep breath, breathing in through the nose, noticing how the body expands as it fills with air, and as you breathe out through the mouth, just gently closing the eyes, just allowing the breath to turn to its own natural. We're just going to imagine that all that thinking, sensation, emotion, physical tension in the body, just going to begin melt away. I'd like you to imagine a steady stream of warm sunshine flowing down through the head into the body. It's as though as it travels into the body, it just dissolves any of that thinking, any of that feeling. It's refreshing the body, leaving you feeling a little more relaxed and at ease. That sunshine, we're just going to watch as it begins to fill the body, toes, through the feet, into the lower half of the legs, again, just melting away any discomfort. You begin to let go of those thoughts, moving to the upper half of the legs. Sunshine, and this sense of warmth, ease, space into the body. Continuing up through the stomach, the lower back, all the way up into the chest, the upper back, and the shoulder. And just allow any thoughts to come and go. Watching as that sunshine, that sunlight fills every part of the body as it travels down the arm, the hand, fingers. It continues to flow down, now fade up through the neck and the throat, to the head and the face, every single last part of the body. Just feeling spacious, ease, sense of warmth, of sunlight, just dissolving any feeling of discomfort. Just allowing that feeling to remain, bringing the attention back to the body, back to that feeling of contact. Awareness coming back to the space around you. And when you're ready, just gently opening the eyes again.
So that was only 3 minutes.
That was only 3 minutes.
That's something that you can incorporate. Everybody surely has 3 minutes somewhere in their day, even if it's in the bathroom.
Yeah, so Headspace and Calm, they have several varying lengths of time. You can get anything, like some of them are a minute long, some of them up to 10 minutes. So you can easily get this app on your phone and try to just take a few moments for yourself to just recenter yourself. And sometimes doing this before your workday can kind of help get you in the right mindset to be able to get through the workday. Another thing, social connection has been a big thing. I am very much a social person, and I miss seeing my people, my friends, my family. Physical distancing versus social distancing. So our social connections are important for our well-being, but how do we do it during a pandemic? And there's a lot of different apps out there for, virtual connection, at least. Zoom, House Party, FaceTime, Google Duo, Google Meet. They're all options that you can use if you aren't already using them to at least connect with your family and friends in other states. And we acknowledge that it's not the same. But right now, trying to make the best that we can out of what we are dealing with. And then wanted to talk a little bit about support groups. So Dr. Mark Greenwald has created this, who, if you guys don't know who he is one of our family medicine physicians here. He has a lot of titles that I can't actually keep up with. But he's created this website, PeerRx. It's a free peer-supported program. It's designed to help physicians and others on the care team move toward thriving, both personally and professionally. And basically, you can go to this website and sign up with a buddy to be able to check in with your buddy periodically. Another plug that we want to talk about, physician or ACP express groups. So Lori and I actually do have these groups. They are not mandatory except for the residents. Sorry, guys.
Not sorry.
Well, no, I'm not sorry. They are mandatory for the residents, but for, we are available. We can do virtual sessions. We kind of sit and talk together about ongoing stress. If we could do it in a smaller group, we could do it in a bigger group if there's any of you are interested. If you desire a third party, if you do not want to talk to the two of us, we can also bring it to the Faculty Vitality and Professional Wellbeing Committee that we're a part of to try to set up an express group that's unique to your needs. I am the pediatric representative and Lori is the ACP representative. But we just want you guys to know that there are options for you to be able to find support groups, to be able to talk with your colleagues about all the things that we're experiencing and maybe not talking about to each other.
And if you have questions about that, feel free to reach out to us about that, because it is really, I think people are I was hesitant to participate in one that I wasn't leading, but I wanted to participate in a couple. And I found them very, very useful. We protect the time. It's an hour, and we encourage sharing, but you don't have to share. Sometimes it's just nice to hear that others are feeling what you're feeling. And maybe I've learned a couple of stress coping strategies from those groups of things I wanted to try than others that I haven't tried before. So it could be quite beneficial.
We do have a couple of MOC questions.
Which is not part of the WHO definition for burnout? A, reduced feelings of professional efficacy. B, feelings of energy depletion or exhaustion. C, increased mental distance from one's job. D, feelings of increased jubilation. E, all of the above are part of the WHO definition for burnout. I think we know that is D. Feelings of increased jubilation is not definition. And then which are signs of significant stress? Isolating or disconnecting from others, decrease in self-care, feelings of increased irritability, feeling indifferent or apathetic, or all of the above are signs of significant stress. And obviously it's that one. Yay, Maggie got it. E. It's E. Yeah.
This last slide, for if you guys are not watching the PowerPoint, it's a print from Story People. The residents know I love Story People. It says, I've always liked the time before dawn because there's no one around to remind me who I'm supposed to be. So it's easier to remember who I am. So if you guys have any questions, feel free to ask. We have a couple minutes. If not, please reach out to us if you guys need anything. We are here to help, try to support one another through all of it.
Yeah. So any questions, or anybody have a story that they would want to share about how they've been impacted by this? Any silver linings, anything? Okay. It's we got to thank you. So that's good. That's good. Thank you for the thank you. And I guess, we only have another minute, so we can go ahead and close out. But again, just remember there are resources out there. Feel free to reach out to us or to your colleagues. Take some time for yourself today. Hopefully the deep breathing exercise, maybe you could see 3 minutes was not a lot. I think we could all incorporate that from time to time. And that will do a lot for self-care. So thank you guys all for participating and being here.
you're definitely not alone.
Yeah.
I think that's the biggest thing to remember. You're not alone. So
Yeah.
please reach out to us. Really, we are happy to have more group sessions to try to talk through all of our feelings.
Yeah. Okay.
All right.
All right. Thanks. Bye, guys.